To promote good governance and accountability for quality service delivery, ActionAid Uganda has built the capacity of hundreds of community monitors, citizen journalists, and activists in Kumi and Bukedia districts.
The work we do under governance is hinged on ensuring that there is social accountability in the delivery of public services. And here is where we engage with the local communities, especially through agents like the activists. We have the citizen journalists and community monitors who undertake the work of oversight.
Issues around education, children are not going to school. The ones who are going to school are not performing. Healthy facilities that are there, structures are there, drugs are not there. So communities have been struggling. Road network has been very poor. So we started working as ActionAid. We said we need to begin organizing people. We need to do advocacy. We need to do campaigns. So we built their capacities in civic rights. We trained some people who are willing to work with the government, monitor government programs, write reports, and also engage with those that represent government in different departments.
As a result of the advocacy and lobbying efforts of activists, citizen journalists, and monitors, the cries of the people for better services are being heard across the two districts. This is a group of activists from Ogino Sub-County, Kumi District. They are boarding a canoe to visit Tisai Island, a hard-to-reach area and home to over 3,000 people, but with no government services.
We don't have a hospital here, we don't have roads here, we don't have government schools here, we don't have even hospitals here. So many challenges we are facing here.
Teaming up with other activists from the island, they immediately start cleaning the area as part of their efforts to promote hygiene.
Today we are doing general cleanliness in this area, Tisai Island. So the benefits of this profiling, as you know that in Tisai we don't have any health center. So through this cleanliness, we are trying to fight some of the diseases like malaria, some of the diseases like typhoid, like bilharzia, which is common in areas surrounded by water bodies.
Through the lobbying efforts of activists, the District Water Office has been able to put up these 2 stanza pit latrine, which is serving close to 500 people. This has helped to reduce the problem of open defecation.
As an activist, we are still pushing government. We want a school, at least a government school, to be built, and we are pushing on that.
Ogino Health Center 3, serving a catchment area of 17,000 people for many years, has not been having a maternity ward and a fence. But through the lobbying and advocacy efforts of the activists and community monitors, a maternity building has been constructed in Ogino Health Center 3 and it is nearing completion. The health facility is also being fenced.
We have been having 2 rooms in our old block. They are not spacious enough. They are able to just accommodate 1 delivery bed and 2 patient beds, so it's been quite too small. Because of this collaboration with ActionAid, we've actually had a remarkable improvement in this facility. And right there, as you see, the maternity was incomplete, but they pushed forward for the completion of this maternity. The responsible authorities were reminded of their responsibility, and that's why you see that maternity at that level.
Also, Kabarwa Health Center 3 in Bukedia district used to be bushy with a rubbish-littered compound and an overfilling placenta pit. However, through community dialogues organized by activists, a lot has changed at the health facility.
Since they always conduct those dialogues with the community members, of course they come and give us the feedback from what the community members have told them, our weaknesses, where we need to correct. And so far, for now, in my department, in OPD, at least I don't hear again much complaints. There's at least some improvement.
Tokor Primary School in Kabara Sub-County is the only government-funded primary school in the sub-county, but it has no structures, which has seriously affected the quality of education and school enrollment.
We only use the slope, 2 classes. In fact, the slope has 3 classes. We put P1 and P2, 1 class, then P3, another one. Then the middle one remains as an office. There are 4 classes. 2 are accommodated in the church. Then 1 in that grass shelter, and the others under shades.
Because of the efforts of activists, a new 2-classroom block, an office and 5-stanza pit latrine is to be constructed at the school.
This school was almost collapsing. When we learned on that, we decided to come for a fact-finding mission. We really found that the school was in a sorry state. At least right now, as I speak right now, you can see behind here, you can see the bricks are behind here. That means through our engagement to the district leaders, there is something now seen. We think we are now progressing, and I believe when we continue doing this as activists, something is going to be done in this school.
The activists have also been successful in lobbying Hope for Kids International to construct this borehole, which is now serving close to 600 households.
Problem we had when this borehole was not constructed, we were fetching water in far areas like in Kakutot, whereby the moment you go in the morning, you come back late in the evening, you find maybe children are just crying hunger, no water, you start cooking late. Those are the problem we had. But since they brought this water, we are now happy because we take clean water. Children are no longer sick again. Like those days, after 2 days, a child is sick. Taking in the hospital, they say typhoid, and no money.
Activists, community monitors and citizen journalists have been instrumental in bridging the gap between the leaders, who are the duty bearers, and the community, who are the rights holders. This has improved accountability and service delivery in the 2 districts of Bukedia and Kumi. The biggest challenge remains harnessing people's capacity to sustainably take action to ensure better public service delivery and accountability from duty bearers. However, with bridging of the gap between citizens and leaders, the future is brighter.
To be sincere, there is a very big improvement. These days, when, for instance, drugs are out of stock in a particular health unit, the population declares it. They don't keep quiet. They call on radios, they involve the media, they want to know, they want to have their problem known. To me, I feel that is the impact of the engagement by ActionAid. Because if you compare the current situation with the past years, where people would have problems and they keep quiet, is no longer an issue. That means that there is now an awareness created. And we want to thank ActionAid. Our plea is that it continues doing what they are ought to do for the good of this country.